Can you see the slide?
Yes, sir.
Okay, okay. So today I'm just taking up an important viral disease. So far your examination is also concerned. This one I hope we have not discussed, na? African horse sickness. Whether we have discussed it not?
No, sir.
Not, na? Okay. So African horse sickness is also known as, there are three synonyms like equine plague, La peste du cheval, Peste equina africana. These are the synonyms of African horse sickness. Okay, just a minute. Somebody. It is an acute or subacute febrile type of this viral disease, mainly this arthropod-borne type. I mean, so far this transmission of this virus is concerned, it is transmitted by some this biting midges or mosquitoes. Okay, that's why it is arthropod-borne disease, mainly of the solipeds. As you know, soliped means those animals which are not having bifurcated hooves. Okay, like I mean these horses, mules, donkeys and all, they are known as soliped animals. And the main characteristic feature of this disease is that there used to be edematous swelling of the subcutaneous tissue as well as the lungs, and hemorrhagic lesions of almost all the internal organs, and excessive accumulation of serous fluid in the body cavities. Okay, so these are the main characteristic feature of disease, and the disease is mainly prevalent in the Middle East, Indian subcontinent, and Spain, and it is occurs in the severe form of this. I mean the disease condition, severe or this outbreaks. Okay, so far India is concerned, in the year 1960, India has experienced and severe outbreak of this disease, African horse sickness, and the disease is caused by a virus known as orbivirus. Okay, and these soliped animals like horses, mules, donkeys, zebra, elephant, and sometimes I mean dog, I mean can also be affected. And this virus, I mean this orbivirus is of double-stranded RNA virus of the family Reoviridae, having 9 serotypes. All these 9 serotypes, 1 to 9, I mean, they are all besorotrophic, and the serotype 9, okay, the 9 one, that are mainly endemic, I mean, form of this disease whenever it occurs, and most of the outbreaks means used to be outside the African country. Okay, whereas the serotypes 1 to 8, they are occurring and prevalent in limited geographical locations or areas of the globe, right? And when we are talking about this disease, African horse sickness in other species of this animal other than this solipeds, okay, I mean mostly the equine mules, I mean horses, mules and donkeys, they are most commonly affected, but sometimes other species may also be affected. So far the dogs are concerned, experimentally it can be disinfected by the ingestion of infected horse meat. Okay, but usually means here in case of this dog, it is not by the insect bites. Means when we are talking about the transmission of this virus by the biting midges or these mosquitoes and all, it doesn't occur in case of dog, mostly due to ingestion of the infected horse meat or feeding of this infected horse meat to the dog. Experimentally means it can be, and there is no any role of the spread and maintenance of this, I mean dog for this disease. And so far the camels and the zebras are concerned, they are affected, but in most of this outbreaks or disease occurrence in case of these camels and zebras, there used to be inapparent type of this infection, means they don't show much characteristic clinical signs and symptoms of this disease. But whereas in case of these elephants, the antibodies can be detected in the serum of East African elephants. It shows that means elephant can also be affected. That's why the antibody level means antibodies could be collected from the this affected East African elephants. That shows that means elephants can also be affected this virus or the virus. Right. Then history, I'm just skipping it. Please go through it. Okay. History is, this you have to buy hard and all these things. So please go through it. Then coming to economic impact, economic importance of this disease, African horse sickness. In case of this Spain and Portugal, where during 1989, severe outbreaks, almost 137 outbreaks were occurred in 104 farms, equine and these farms, horse farms. Okay, out of that, these 206 equines died and destroyed, whereas 1,70,000 equines have been vaccinated. Out of that, 82 of the vaccinated equines died of this infection. Okay, and the eradication program costed around this $1.9 million. Okay, so like this, in the US horse industry also, it has been shown that the value of the sales from the equine have been reduced to 1.75 billion, and the equine inventory costed around 5.25 million these horses, and the equine sold at the this amount of this 5,58,000. Okay, like this, due to the death of this animal and this equine, these horses and all, a great loss, direct loss have been faced by the country or as well as the farmers and all. So in the equine industry, it is a great loss. Okay, not only due to the direct loss due to death of this animal, sometimes due to the vaccination cost, treatment cost, labor cost and all. If you count for all those things, it shows that it is economically important disease, right? That means this African horse sickness is an economically important disease. Okay, then geographical location also, I'm just skipping it, and only one thing I would like to say is that the occurrence of the disease used to be seasonal because of the involvement of this arthropod, like this biting measles or this mosquitoes and all these things. So the peak used to be during the late summer and early autumn, where the population of this biting measles as well as the mosquitoes used to be more. Okay, that's why there used to be influence of the climatic condition for the occurrence of this disease. The prevalence of this disease used to be influenced by the climatic condition. Okay. And coming to morbidity and mortality, it varies with the species of the animal, then previous immunity status of the animal, and the form of the disease. Means the disease used to be in shown in 4 forms. Okay, that I'll show you in the next slide. And the mortality used to be based on the species, of the animals. Like I'm just giving in this table that when horses are concerned, mortality used to be 50 to 90%, and when mules are concerned, 50% mortality used to be there. And the European and Asian donkeys are concerned, 5 to 10% only. It is not much high, but the African donkeys and zebras are concerned, very rare mortality they used to be, and they used to die rarely. They don't much show this mortality. Okay, and when we are talking about the mortality basing on the different forms of this disease, there are 4 different forms. Those are acute pulmonary form, commonly known as Duncombe, acute subacute cardiac form, also this known as Dickov, and mixed form. That means pulmonary and the cardiac form is mixed. And the 4th one is mild form, also known as horse sickness fever. Okay, so according to these 4 forms, when we are talking about the mortality basing on these different 4 forms, so in the acute pulmonary form, that means Duncombe, the mortality may be very high, maybe reaching up to 95%. Okay, and then subacute cardiac form, that is the Dickov form, where 50% mortality or little bit more may be there. And when there is a mixed form, that means pulmonary and cardiac forms are mixed. Okay, mixed form. Then means it is another this high, I mean this mortality, 70 to 80% mortality used to be observed. And in the fourth form, that is mild form or horse sickness fever. So in this case, typically, I mean this the affected animals used to recover from this infection, means they don't much so I mean this mortality. Okay, so mostly they used to recover from the infection in the mild forms. And this morbidity mortality is we have this talk that I mean this according to your species, and then this immunity status, previous immunity status of the animal, and the different form of the this animal, it is variable. And as well as it may be variable with the exposure and the species as well as immunity also. Like then when we are talking about the horses, the mortality may be between 50 to 95%. Then cardiac, as we have already the 50 to 70 mixed, 70 to 80% and all, right? But one thing, pulmonary form, I mean when the respiratory failure, I mean this lungs affection used to be there, leading to respiratory failure and all. So in this form, mostly, I mean the animal used to die. It is highly fatal. Then I mean this equine and all these things, actually other this species like mules, and donkeys and African donkeys and all. So I mean I have already shown in the previous table, right? Then coming to transmission, animal transmission of this disease. So it is not a contagious disease, okay? And the disease used to be spread by the bites of these arthropod vectors like biting midges of the family and this Culicoides and this species. Then other potential vectors are your mosquitoes, biting flies, and even the ticks. Okay, but sometimes some mechanical transmission of the virus can also, I mean, this takes place. Okay, and when we are talking about this viremia, presence of this virus and getting into the circulation of the affected animal, like these horses, like more commonly in the equine families, equidae, then in case of these horses, it used to be means within 12 to 40 days of infection. I mean this after getting into the virus used to be present in the circulation. When we are talking about the zebras and African donkeys, it may take longer time. That means up to 6 weeks of infection. Okay. And coming to pathogenesis, so after the bite of this arthropod, like I mean your biting midges, mosquitoes, biting flies, or even the ticks and all these things, which carries this infectious agent, this virus or the virus from the infected animal. Then when they are biting the other healthy animals, horses and or the other families and all, then they used to gain entry. Okay, from the bite, from the site of the bite after entry, the virus start replication in the lymph node, neighboring of this as I said lymph nodes and all. From there, I mean they used to gain entry into the circulation, leading to viremia, and it may be spread out of different this organ and tissues of the body, where the virus multiplication takes place in the spleen, lungs, lymph nodes, as well as the reticuloendothelial cells, and they will lead to widespread vasculitis. Almost all the vessels used to be affected, showing this inflammatory reaction on this widespread vasculitis. Now coming to clinical signs and gross lesions, the lesions. Okay, the disease of the African horse sickness, as we have already discussed, and this I have already given you that 4 different clinical forms used to be there. Those are acute pulmonary form, commonly known as dun cough, subacute cardiac form, and which is commonly known as the cough, mixed form, that means pulmonary and cardiac forms are mixed, then mild form, that is horse sickness fever, and this in these 4 different forms you can come across when we are talking about the clinical manifestations. But in all these forms, one very common this feature is that clinical finding is that intermittent fever of 105 to 106 degree Fahrenheit. Okay, this is this type of this high rise of this body temperature, intermittent type of this fever. So that is a characteristic feature of all the 4 forms of this disease, right? And when we are talking about the incubation period, experimentally it may take, I mean, this 2 to 21 days. When we are talking about the natural infections, usually it used to be 3 to 14 days. And the incubation period means maybe variable according to the different form of this disease, means for acute pulmonary form and this acute pulmonary form 3 to 5 days, subacute and this cardiac and this edematous form there 7 to 14 days, then mixed form, this pulmonary and the cardiac mix, where and this incubation period may be 5 to 7 days, and the mild form, that is horse sickness fever, okay, in that 5 to 14 days maybe. So there is another this variation in the incubation period also according to the form of the disease. Clinical forms means 4 clinical forms, so I mean different variation in the incubation period also. So now coming to these 4 different forms, in these 4 different forms, how I mean those affected animals used to, so what kind of these clinical manifestations. Okay, so the first one, acute pulmonary form, okay, or part acute type. So in this case, which is commonly known as dun cough, okay, and these things are very important. I mean this dun cough, the cough in the definition or and the short note or somewhere, I mean this you may come across even during the Bible and all these things. So in this dun cough, acute pulmonary form, it is the most common form among the 4 clinical forms of this disease, where the affected animals used to show sudden fever, high rise of this body temperature, severe dyspnea, spasmodic, this coughing, spasmodic and this coughing, this painful, this coughing. Well, and this you are coughing and all, you will find and this painful, this spasm in your throat and all these things, trachea, like, okay. So spasmodic and this coughing, that is acute respiratory distress, then mortality may reach up to 95%, as already this I have shown in the table also. And the death of the affected animal occurs within a few hours after the onset of this pulmonary edema. Okay, and the affected animal may stand with legs apart and extended neck, as I am showing a picture down here. Okay, the leg used to be this apart from one another. This, I mean, it used to remain this apart in this distances, and the neck used to be extended. So this is very typical form of this pulmonary and this acute pulmonary form, what we call this dun cough, right? Then in case of this cardiac form, subacute cardiac form, or commonly known as the cough, so you may have non-purulent type of this conjunctivitis, edematous swelling, particularly of the supraorbital fossa, or temporary, this fossa, means I'll show you the picture in the next this slide. Okay, means just above the eye. Okay, and the eyelid, and the mortality used to be from 50%. Okay, I mean mostly, I mean this within this 40%, they were 50% mortality used to be there, and that usually occurs due to cardiac failure and as well as hypoxia. Okay, and the donkeys, when we are talking about other than the horses, the donkeys commonly suffer from the mild form of this disease, characterized by mild body and this fever. I mean this rise of this body temperature. Okay, and the animal is standing, I mean showing the 4 legs apart and with extended neck. Okay, this is particularly a very common feature of clinical finding. The stands of, I mean this of the this acute pulmonary form, that means dun cough. And these are some more just pictures showing the, I mean this acute pulmonary form, dun cough. I mean this other, I mean we have this explained that the acute rise of this body temperature and respiratory distresses, dyspnea, trachepnea, forceful and this expiration, profuse sweating, spasmodic coughing, frothy serofibrinous nasal discharges like this from the nostrils. I mean very severe, I mean this frothy serofibrinous type of this discharges, exudate used to be coming out. Okay, excessive like this. Okay, and this rapid death. So this foaming or foam coming out of this nostril, I mean, due to this pulmonary edema. It is very much, I mean, this indicative for this acute pulmonary form of this African horse sickness. And these are some more these pictures showing the this frothy or foam and this exuding and this exudate or coming out of the nostrils like this. Okay, and this one is just showing depression of this affected horse, and with bilateral supraorbital edema, this area. Okay, just above the eye, this area. This is known as supraorbital edema. I mean, this edematous swelling in this supraorbital fossa region. Okay, or temporal fossa, this is also known as. These are all showing exudation of foamy exudates excessive from the nostrils when this pulmonary edema is too much severe, right? And in case of that cardiac subacute, I mean, this cardiac form also known as decope and all. So that this supraorbital and this fossa swelling and this edematous swelling, this area, this very particular, see, too much swollen of, right, swelling. So this is a temporal fossa also, it is known as. So this is very much indicative for this cardiac form of this African horse sickness. And the swelling may be, edematous swelling may be around the eyelids also, and intermandibular space also may be showing this swelling, or sometimes down there in the neck, thoracic region, brisket, as well as the shoulders. All the, I mean, these subcutaneous regions of these parts of the body, like neck, thorax, brisket, and shoulders and all. So there used to be edematous swelling. And out of this, of course, that supraorbital or temporal fossa, this swollen due to edema is very much, I mean, this characteristic. And in at the terminal stages, the animals may show pinpoint hemorrhagic lesions under the, this ventral portion of the tongue as well as the conjunctiva. Okay, and that occurs within 1 week. And here showing this congestion edema of the conjunctiva like this. Okay, supraorbital and this fossa showing this shoulder swelling, and also on this temporal fossa it is also known as, right. So these are some more pictures showing, I mean, the supraorbital fossa, this showing very much, I mean, this edematous swollen. Okay, and the animal is looking very much, I mean, this depressed. Okay, and the extension of the neck, then, I mean, the swelling of this throat, chest, and brisket region. All these are all other, and the clinical findings or this manifestation of this disease. Then, in case of this mixed form, that means cardiac and the pulmonary form, these two forms are mixed. So that's why both the these lesions or the signs means associated with this pulmonary cardiac form mixing. So that's why cardiac signs of like this severe respiratory this distress and this very difficulty in breathing and this and all these things you will need to be there. And the respiratory sign used to be mild, but it may be followed by edematous swelling and the death of the this animal, usually due to your this cardiac failure. Okay, and it may be diagnosed. Actually, this mixed form can be diagnosed while just conducting the post-mortem examination, that both the this respiratory as well as the cardiovascular system this used to be affected, showing the lesions. Okay, means mixed type of these lesions will be there. And the fourth one, that is a mild form, also known as horse sickness fever. So in this case, of course, there will be mild clinical signs like maybe this rise of this body temperature. The fever may be lasting for 3 to 8 days, but during the morning time, this you cannot detect that and the animal is having fever. But when the this afternoon is there, and during the afternoon time, this is increasing, or this body temperature is there, but during the morning time, this remission or it is not, it cannot be detected. So that type of this fever, means used to be in this mild form and all. And other signs other than this rise of this body temperature, which used to be mild and all, and there may be mild this anorexia and depression, and all the visible mucous membrane used to be congested, and the animal may show increased heart rate. Okay, And this form, I mean, this animal usually typically they used to recover from this form, and it is I mean, this not showing much, I mean, this fatality, almost, I mean, this nil, you can say, or rarely, means one or two, this animal die out of many, I mean, right? Then coming to pathology, post-mortem findings. In case of the pulmonary, acute pulmonary form, that means that cough, so there will be hydrothorax, severe pulmonary edema like this. And in case of the cardiac form, means yellowish gelatinous type of this exudate may be found in the fascia of the head, neck, and shoulders, as well as there may be hydropericardium. Okay, just around the this heart, I mean, this heart covering the pericardial sac used to be this filled with this edematous split. And so far, in case of this mixed form, the lesions will be of mixed type. That means the lesions of the respiratory system, the lungs, as well as the heart, like, and this all this two, I mean, these forms and the lesions used to be mixed up, right? Then these are some this picture showing the lung lesions, and due to the pulmonary edema, okay, see the this lungs used to be highly edematous, and this very much prominent, I mean, this and the distended, I mean, distension, and this due to this accumulation of the edematous split, okay, in the, I mean, this lungs. Then these are the pictures showing hydropericardium, and this myocardial, this necrosis. If you make a cross section of the this heart, you can find some this myocardial necrotic lesions and pulmonary edema in the lungs, right? Then these are some more of this picture showing pulmonary edema, then petechial hemorrhagic lesions on the serological layer of the this different visceral organs like this intestines and all. And this is mainly, I mean, this is kind of this generalized type of this pinpoint hemorrhagic lesion in many of the visceral organs or the serological layers of the intestinal, gastrointestinal tract and all. So this is highly indicative for the viremic phase of the viremia of this or viremic or septicemic condition of this disease, African horse sickness. Okay, and when you make the section of the affected organ and tissues, okay, so if you see, I mean, any this section of the vessels, okay, so and you can see the this this vasculitis there in those this affected vessels and all, okay, and I mean, they may show, I mean, this edematous swelling in the adventitia, so adventitial edema I'm showing here in this arrow mark. Then focal myocardial necrosis may be there in the heart muscle, and I mean, this hydrothorax or hydropericardium, and I mean, other this body accumulate this body cavities and this filled with this edematous split are also very common. Okay, like maybe mostly in case of this cardiac form or sometimes mixed form and all, right? And the subcutaneous or the intramuscular this tissue of the neck region, edema, shoulder, sorry, and the brisket and the shoulder, means this part used to show, I mean, this edematous or serofibrinosus type, I mean, this exudation and all. Okay. Then finally, diagnosis. So diagnosis can be based on the history of the recent arrival of exotic horses, mules, and donkeys is very much important. Whether, I mean, you have brought some new on this stock of this some other states to another state, like where there is no any certificate for vaccination against the disease or like that. Okay, then other is the clinical signs and symptoms and the PM findings. So mostly those four forms, this acute pulmonary form, then I mean this subacute cardiac form, mixed form, and the mild form, this horse sickness, fever. So like that, those clinical signs and symptoms and lesions what we have discussed, so those are also important for suggestion that for suspicion for this disease, African horse sickness. And the clinical samples, okay, to be, I mean, this mainly, I mean, this for the laboratory analysis and all these things. So we can collect the whole blood, okay, then the spleen, lymph node, I mean, can be collected during this examination and during post-mortem examination, And the serum also can be separated from the at this all blood and all, and utilized for detection of antigen antibody by AGPT, ELISA, or this or complement fixation test, virus neutralization test, or indirect fluorescent antibody technique and all. And some inoculation tests also can be conducted in this using this laboratory animal like this mice. So in those animal, these lab animals like this mice, that will occur if the sample which is we are inoculating, if it is from a positive this case of your African horse sickness, then the death of those mice occurs within 4 to 7 days. Then the molecular technique, this RT-PCR, can also be conducted for detection of the viral genome of this virus. Okay. Then lastly, differential diagnosis. So differential diagnosis of this African horse sickness, because some of this horse and these diseases which may have little bit this confusion because of the similarities maybe in the signs and symptoms or even the lesions and all. So we have to rule out, we have to separate or differentiate this disease from those similar type of diseases like your anthrax, this horse and this anthrax, then equine encephalosis, equine viral arthritis, equine infectious anemia, then equine morbillivirus, this pneumonia, then purpura hemorrhagica, and equine pyroplasmosis. So these are the different and these equine diseases which may have some confusion due to some similarities in the clinical signs and symptoms, or maybe in these lesions and all. So we have to rule out and confirm by detecting the viral genome, of course, then their antigen, antibody, and all this. Otherwise, from the clinical signs and symptoms, and even your both and the histopathology, means we cannot come to to confirm that, to say that this is African horse sickness. So laboratory confirmation by detecting the viral genome and this antigen, antibodies, and all this, that is another requirement and very much important to just confirm this disease. Okay, so that's all about this disease, African horse sickness. And that's all for today. And I'll just take some more this viral disease and few this bacterial disease also I have left. Okay, so let's try to complete and cover up all this this disease we have left behind. Okay, so that's all for today. Okay. Yes. Which cup? Cardiac and a pulmonary form. Pulmonary form means respiratory involvement, respiratory system involvement, lungs edema. This is pulmonary edema. Okay, where this as I have shown you the sign of your, so far the sign is concerned, frothy or foamy exudation from the nostril. Okay, that used to be very much excessive and very severe, and very much respiratory distress, difficulty in breathing will be there, and on this extension of the neck because of the this coughing and all these things. When they are coughing, they may have some this painful coughing, spasmodic this coughing, that means painful type. This spasm may be there in the trachea and all these things, tracheal muscles and all. So that will indicate that respiratory form is very much severe. Then cardiac means in this cardiac form, you will not have such kind of this respiratory signs. You will have some edematous swelling, particularly what I have mentioned, supraorbital fossa, and your this edematous swelling under the subcutaneous tissue of the neck, brisket, and shoulders. So these things are more, this indication, which of course in both these cases, like for example, in pulmonary form, if the horse die, then if you conduct a post-mortem examination, mostly the lesion will be confined to the respiratory system, means pulmonary edema, right? Then when in the cardiac form, it will be confined to the cardiovascular system, mostly the heart. Their hydropericardium may be there. And then if you make cross section of the heart, then myocardial disc necrosis may be there with hydropericardium and some other this accumulation of this edematous fluid, maybe in the hydrothorax, sorry, I mean this thoracic cavity and other parts, like as I have shown that you know, I mean the subcutaneous tissue of the this neck, brisket, and shoulder and all. And the respiratory failure, this cardiac failure will lead to death of the animal. Means involvement of the system is different. Pulmonary form in the lungs, and then cardiac form in the on this heart mainly, then some vessels, right? But sometimes that used to be mixed also. Means mix of these two, both signs and symptoms, even the lesion also will be mixed. Right? Can you follow me? Okay, like that, I mean, just from the clinical sign and the clinical finding manifestation, whether more involvement, sorry, I mean, there's more signs is confined to respiratory system, showing respiratory distress, respiratory problems, then pulmonary, acute, this pulmonary form, that is what we call Duncombe. Then, if it is not showing this respiratory sign, but more swelling and the supraorbital fossa, then subcutaneous tissue of the neck, shoulder, and the brisket region is too much edematous, swollen, and all, right? And the animal is having, I mean, this what is a diet due to cardiac failure and all these things. And if you conduct, and the lesions also confined to the on this cardiovascular system only, like that means cardiac form it is. Then when both are mixed, then means it is a mixed form. This way we have to this differentiate, right? Okay, okay. So I will continue this other diseases in the next class. For today, let's complete it and let's wind it up here. Okay.